In this video, we'll study about anatomy of gluteus maximus. Introduction. It is a large quadrilateral muscle. It covers the posterior surface of the pelvis. So before we go into origin, insertion and nerve supply, I have a mnemonic. So the mnemonic is, I guess that ICSC kid is unable to move because of sciatica. Coming back to the origin, you have to remember this word ICSC. So it originates from the dorsal segment of the iliac crest and the side of the coccyx and also the lower part of the sacrum. Remember this bones, which is coccyx and sacrum, and also the iliac crest, the dorsal segment of the iliac crest, and the aponeurosis of erector spinae muscle. Right? So this is the origin, ICSC. Coming to the insertion and nerve supply, you have to remember this IG, I guess, right? So the nerve is inferior gluteal nerve, and the insertion, the deep fibers are inserted into the gluteal tuberosity, and the greatest part of this gluteus maximus is inserted into the iliotibial tract, IG. Okay, now coming to the action, you have to remember able, right? So it causes abduction of the thigh, AB, abduction of the thigh, and lateral rotation of the thigh, and also extensor. It is the greatest extensor of the thigh at the hip joint. The main action is extension, and also along with the extension, it also causes abduction, 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 and lateral rotation of the thigh. So with this mnemonic, I guess IG stands for insertion and the nerve, inferior gluteal nerve, and the iliotibial tract and the gluteal tuberosity. That ICSC kit, iliac crest, coccyx, sacrum, erector spinae, is able, right? So able means abduction, lateral, and the extensor of the thigh. Sciatica mnemonic is used in the next part, which is the structures under cover of gluteal maximus. Yeah, we'll talk about the muscles, we'll talk about the vessels, nerves, and arteries, what are all covered under the gluteal maximus. First, coming to the muscles. Obviously, the gluteus maximus is very large. Under this, we have two small muscles, which is gluteal medius and the minimus. So that is done. And again, rectus femoris, quadratus femoris, piriformis, obturator internus, obturator externus. So remember these three words: femur, glutes, and obturator. So from the word femur, you have to remember rectus femoris, quadratus femoris. From the word glutes, remember gluteus medius, gluteus minimus. From the word obturator, remember obturator internus along with the two gemelli, and obturator externus, and also piriformis, P. Now coming to the next one, which is vessels. Here we use the mnemonic sciatica because the vessels involved are superior gluteal vessel, cruciate anastomosis, inferior gluteal vessels, artery, which is first perforating artery, and T for trochanteric anastomosis, I for again internal pudendal vessels, and ascending branch of medial circumflex femoral artery. Again, you have to remember this. See, here I mentioned to you to remember femur, glutes, and obturator, right? Here also you remember femur. From the femur, you have to remember the vessels present along the femur. One is trochanteric anastomosis and the cruciate anastomosis. It is present along the femur, right? And also medial circumflex femoral artery. Remember this three. And from the glutes, you have to remember superior gluteal vessels and inferior gluteal vessels. And from the word P, you can remember perforating artery or internal pudendal vessel. Coming to nerves, again remember femur, glutes, and obturator. So coming to glutes, superior gluteal nerve, inferior gluteal nerve, and also in the back of the thigh you have sciatic nerve, which causes sciatica, right? You have sciatic nerve. And from the word femur, remember quadratus femoris nerve, nerve to quadratus femoris, and from the word obturator, nerve to obturator internus, and from the letter P, remember pudendal nerve. So under the nerve we have pudendal nerve, under the vessels we have pudendal vessels, but here the P stands for in the muscles piriformis. Now coming back to other nerves, which are cutaneous nerves like posterior cutaneous nerve of thigh, perforating cutaneous nerves. Ilium, ischium, sacrum, coccyx, femur with the greater trochanter, all are covered under the gluteus maximus. Ilium, ischium, coccyx, sacrum, femur with the greater trochanter. And the joints involved are hip joint and the sacroiliac joint. You can easily imagine it. And ligaments are sacrotuberous ligament, sacrospinous ligament, istiofemoral ligament. Bursae are trochanteric bursae, bursae between the gluteus maximus and the vastus lateralis, ischial tuberosity bursae. So this is the picture. The main large quadrilateral muscle you are seeing in the posterior aspect of the thigh is gluteus maximus. Under it you have gluteus medius and gluteus minimus, rectus femoris, quadratus femoris, obturator internus with two gemelli. Okay, so this is the origin. You can see from the ICSC, right? So posterior ilium, posterior sacrum, and superior gluteal line, and insertion into IG, iliotibial tract, and gluteal tuberosity. So this is the gluteus maximus. You can see 75%, that is the greater part, is inserted into the iliotibial tract.